Welcome to Dina, Mina show, live from Stockholm.
And today our guest is one of the key figures behind Digital Health Days 2014, the event manager for Digital Health Days 2015, Nima Jokilaakso. Welcome.
Thank you.
Welcome, Nima. So how did you get involved in Digital Health Days?
So actually, back in the days, I used to be a researcher at the Royal Institute of Technology. And while I was doing my PhD, I actually started a company called DD Innovation. That's a startup in digital health. And that was actually how I got involved into the area of digital health. And after receiving my PhD, I was recruited for Stockholmsmässan to work with this event. And it's been very exciting since that.
So what have been you excited about and what did you learn from Digital Health Days 2014 last year?
So first of all, one of the really wonderful things with the Digital Health Days is that there's so many different people from different areas that are connected by digital health. So that means people from the life science sector, the ICT sector, we have people from academia, the healthcare sector, investors. So there's a big group of people that come to Digital Health Days with different perspectives. That's one nice thing about it, that when you look at this area of digital health, there are so many different opinions about it, and it depends very much from which perspective you're looking at it. And that coming to digital health and being there is a nice way of really kind of learning how other people perceive it and what are the concerns they have and what are the opportunities that they're seeing.
Digital Health Days 2014 was successful and you learned a lot of things from it. How are you going to use the knowledge from Digital Health Day 2014 in 2015?
Oh, that's a very good question. So one of the things we did with Digital Health Days 14 is that we introduced the Mentometer buttons. And this was a way for the delegates then to answer different questions that we had on the screen. And one very important thing that we've learned using those Mentometer buttons was that one of the areas that people had a consensus and agreed upon is the importance of involving the patients. That there's a drive in having the patients as one of the team members being very much involved in their own healthcare. But another thing that was also very clear is that the question is then how to include them. And I think this is one thing that we will need to look at Digital Health Days 2015, which can we give examples of how patients should be involved and how does that affect the whole system? Because that's another thing that was discussed a lot, is that what we're seeing is that while it's technology that's the driving force making this possible, an enabler, it is still very much that we see that the patients and actually just the general consumers that are having an interest in making this reality. But the question is then, how does this affect the dynamics between the healthcare providers and the patients? First of all, in the healthcare system, so how is the relation between the doctor and the patient, the nurse and the patient being altered? And that can always be a challenge when you see a change in a system that you're used to, because it's changing the status quo. But another thing is also changing the dynamics of how we consider the patient. Are you a patient only when you enter the healthcare system, or should we also look at these, let's say not healthcare, but just health-related issues? Let's more into prevention and monitoring that comes in, both even when you're not at the hospital, like when that comes to, for example, when you're just doing your exercise or whatever. And this has become very much a reality now, that there's these kind of questions happening. But finally, also one thing that was very obvious is that when we look at digital health, there's been a lot of discussion about that in the US we see that there's a lot of companies being formed, there's a lot of investments in the area, while we see that in Europe there's not really much happening yet. And this is a problem, and one of the key things that people were talking about and that we also saw in the Mentometer buttons was that one reason for this, it has to do with the sustainability, and in particular when it comes to the revenue generation. How do you actually make the revenue from your innovation? And that's only when it actually becomes an innovation and not just an idea. So this is a topic that we will discuss at Digital Health Days 2015. We'll also have speakers discussing if there are particular ways of looking at revenue models. But also when it comes to implementation, because that's another hurdle that we have seen that is a big problem, especially in Europe, is that how do you actually get access to the healthcare system and it can implement your idea? So these are pretty much very broad topics, but that's very much in line with what we're doing with Digital Health Days, is kind of creating the debate around important issues when it comes to digital health.
Just to sum up, so we understand what will be the main topics of Digital Health Days 2015, but still, what should we expect when we come to Digital Health 2015? What will be there? What we should be looking forward to?
Okay, that's a very good question. So, first of all, I'm really glad to announce that we have a really excellent line of speakers. So we will have an opening speaker that is called Brian Goldman. He's an author of a best-selling book, for example. And we will also have patients on the stage, as we did last year. But first of all, I mean, the quality of the speakers is, again, one level higher. So we're really trying to deliver on that point. The second thing is that we are really, again, trying to get those stakeholders at the event that we felt that was missing last year. And for example, although we had patients on the stage and we had doctors on the stage, we actually have an offer this year for patient representatives and healthcare workers to get a free pass. And that's by applying directly on the homepage and contacting me. So there's a set of free passes to make sure that they're not only there as speakers and involved in creating the program, but also in the audience, so that you can actually discuss and meet them. Another thing that we're looking at is also how to create activities at the event where you can actually meet those people that you're intending to meet at the event. So kind of helping out to create this networking experience.
So greater speaker, better communication and networking experience, and overall a lot of excitement and working atmosphere.
Indeed.
Thanks a lot, Nima, for joining us today, and good luck with Digital Health Days 2015, and looking forward to the conference.
Thank you.
Thanks a lot for tuning in, and see you in the next video.
Bye-bye.